Hello, everyone. Welcome to another episode of the Anti-Pharmacist podcast. It's a new week here. Yes, I hope you had a nice weekend. I say that all the time, right? Well, it is because I genuinely care and I want to know that you actually had a nice weekend. Okay, that being said, I believe that you did, right? Today, I'll be talking about a case. It's actually about your skin. You know that we are in the hot season, let me put it that way, and people tend to sweat a lot this period. So because of that, this thing I want to talk about is usually common during very humid and hot seasons. Okay, a lot of people have it, and people think that it's only children that have it. Well, it could it would surprise you that some adults actually manifest this infection, and it can be embarrassing, right? It doesn't mean that you are not clean or anything, but like I said, it thrives majorly in moist and humid environment. Well, what I'm talking about is ringworms. Yes, ringworms. I told you that on this podcast I'll be talking about some conditions that usually present at pharmacies. People just come in and complain about these things, and I think that you should know about them, and you should first know what they're about, how to prevent them. It is when you have done all in your power to prevent them and they eventually happen, let's put it that way, that you should actually seek professional help in terms of visiting your pharmacist or going to the hospital. All right. Yes. So talking about ringworms, I know the name ring and worms doesn't really mean that this infection is caused by a worm. No, it is actually an infection caused by fungus, okay, called tinea. That's the group of fungi. But it can cause infections in different parts of the body, okay, which eventually form ringworms. So there are different types. They are usually contagious. They are transmitted from one person to another, usually by contact, maybe by contact of skin to skin, or using the clothing of those people that have it. You see it, it is red, it is itchy, and it will be scaly in a way, and you see it as forms of ring. When we were younger, it used to happen that most children have it on their heads. That's what some people used to call lapa lapa back then. That you just see a ring on your scalp, and that one on the scalp is usually scaly and white. But the ones on the skin, sometimes they can be whitish, especially if it's in a dark skinned person. But if it's in a light skinned person, you see it as red scaly rash. Okay, it's usually very itchy, and it can even be transmitted from animals, right? And there are different types. It can appear on any part of your body, really. It can appear on your arm, your legs, your face, your scalp, even in your groin, that is in your private area, okay? The one that appears on the foot, those ones that appear in between toes or at the base of toes, that we call athlete's foot. That is the type of ringworm as well. It is tinea pedis. It causes that burning rash on your toes, that crack that can sometimes make your feet to smell bad and be bringing out one whitish or yellowish liquid. That is tinea pedis. It is a type of ringworm. There is jock itch, which is tinea curis, the one in your groin, your upper thigh, or your rectum, that can sometimes form blisters that you just be itching and itching. There's also the one of the scalp, tinea capitis, okay? You just see bald spot. You see that hair is not growing there anymore, and it could become bigger and permanent if care is not taken. Then the ones on the hands, they are called tinea manum. It's like they are named after the different parts of the body using, I think, Italian. So you see it on the hand. There will be cracked palms. There will be ring-like patches on the palm. Then even beards, can have ringworm. Those that do beard gang, if you do not take care of it very well, if you do not groom it well, it is possible that ringworms will appear in your beard area. It is called tinea barbae. Okay, It could spread to your neck, to your chin, to your cheeks, and they can even be filled with pus. All right. Then we have the one of the toenails and fingernails, which we call onychomycosis, tinea unguium. Okay. The nails become thick, discolored, even deformed. Your cuticles become dirty and thick. Those are the kinds of ringworm infections that there are. Okay. I've told you what they look like. Now, who are susceptible? What are the risk factors for ringworm? Number one is weakened immune system or autoimmune diseases. I've told you that ringworms are caused by fungi, okay? And these microorganisms, they kind of like to take advantage of reduced immune system, because in truth majority of them are present in the atmosphere. Some are even on our skin as the normal flora, okay, but there's a limit to which they must grow. If your immunity works well, your body helps to keep their population in check such that they do not manifest as infection. They are just there protecting your skin from some kinds of bacteria. But when it gets to the level where your immunity is reduced, your body cannot fight the overpopulation anymore. They grow beyond proportion and manifest as the infection. Okay, so if you have autoimmune diseases, it's possible that you could see manifestations of ringworm on your skin or other parts of your body. Then those that participate in eye contact sports, the likes of wrestling, or those that do judo, those in which you have to touch each other a lot or rub skins against one another. It's possible that you transmit ringworm from person to person in that instance, okay? Then those that sweat excessively, that is hyperhidrosis. I told you that these fungi, they thrive in humid and hot environments. If you wear your socks all the time inside your shoe, that your feet cannot even breathe, it's possible that you start having athlete's foot, okay? Or like this weather that we have now in Nigeria, where it is very hot, that before you know it, you're sweating. If you do not take care, if you're not careful, it is possible that you develop ringworms on your skin. Okay. Then use of public showers. It's possible, like I said, it's still contact. Somebody with ringworm could have rubbed their bodies on maybe the water closet or the walls of the showers, okay, or just touched surfaces in that bathroom, and you go there, you do the same and touch your body, you could transmit it that way, okay. And those that work closely with animals, like veterinary doctors or animal carers, dog walkers, you could also have ringworms. Like I mentioned, it could be transmitted from animals to humans, okay. Those are the people at risk of ringworms, okay. And it is a very common infection. It affects about 20 to 25% of the global population at any given time. And the symptoms, they can appear between 4 to 14 days of the infection, okay. Itchy skin, bald patches on the head, flat patches on the body with round borders, ring-sized or ring-shaped scales or plaques on the body. Those are the obvious signs or symptoms of ringworm. And they are no more than that. Ringworms are usually not systemic. They are things that you see on the body. So that makes it even easily diagnosed. Yes, it's not like it will cause you to start vomiting or to start having fever. It just causes discomfort majorly. Your body itching, you having to start scratching, you seeing that red patchy or white scaly thing on your skin. It makes you uncomfortable. It makes you look unpresentable. That is the major thing with ringworm. And how is it managed? Usually we use antifungal medications because, like I said, it is caused by fungi, right? There are many over-the-counter antifungal creams, lotions that you could use, and there are antifungal tablets as well, oral medications that you could use. When you present to your doctor with ringworms, they know what to prescribe. But the thing with fungal infections is that they are quite stubborn, very stubborn. They do not resolve easily. That's one thing with fungal infections, okay? because part of their metabolic processes is similar to what is needed in humans. So it's like they are competing with you for those things that they need for survival, especially the cholesterol. They use cholesterol in human body during their metabolism, okay, during their growth process, during their normal cell activities. So it is usually difficult to cut off that step of metabolism to kill or inhibit their growth until you have bombarded them with the medication to an extent where their population is so reduced that your immunity can take over from there. I hope you understand this. So this is to tell you that if you are giving an antifungal medication, the first thing you need to ensure is that your immunity is at the top bar. It is top notch. Nothing is affecting your immunity adversely. And number two, use your medication as prescribed for as long as it is prescribed for. That is, the duration must not be shorter than it was given. Usually, you cannot treat a fungal infection for less than 4 weeks, most times. Okay, 4 weeks, that's 1 month. So you have to use your antifungal medication consistently for at least a month. Sometimes it can get up to 3 months or even six, depending on the severity and chronicity of the infection. Sometimes too, you can be given shampoos, especially if it's to do with your scalp, to use. So please make sure that you use these things as you should. Now, a note of caution: you should not use steroid creams. I mentioned that antifungal creams, stick to those, because they are triple action creams that contain steroids, antibiotics, and antifungals. Don't be tempted to use those. That, oh, yes, I have this cream at home, it contains some antifungal medication, but it has antibacterial and steroid as well. No, because steroids have been found to make the ringworm or any fungal infection even worse. Do you understand? Over time, it could resolve at first, but after a few days, you see that it keeps getting worse. Don't be tempted to use steroid creams. Now, don't depend on your immunity alone, like I said, because these infections may not go away by themselves. They are not viral infections that may resolve after a while, because viruses cannot survive for long outside the living organism. Okay, but this fungi, I've told you that they use that thing that you also need for survival to survive, so they can stay with you for long if care is not taken. Now, to prevent it, I've mentioned it in the course of the discussion: change your socks and underwear daily or more frequently if they become damp or soiled. Shower immediately after contact sport or exercise, okay? When you're sweating profusely. In this heat, in this period that we're in, I do not expect anybody to shower less than twice a day, okay? Because you'll be sweating a lot after coming from work or something. You should not leave sweat on your skin. Wear sandals, okay? Do not always wear shoes about. Wear sandals, let your feet breathe, let your toes breathe. Then after showering, dry your skin thoroughly. Do not let water remain on your skin, especially in your armpit, in your groin area, between your butt cheeks. Clean everywhere between your fingers, your toes, so that there is no dampness for the fungi to grow in. And wash your clothes, your athletic gear, your towels regularly, especially in hot water and detergent, to kill whatever fungi is on them. Okay, do not share towels, boxers, especially for guys, bed sheets, clothes, combs, or even personal hygiene items. Do not share them. Those can be mediums for transfer of fungal infections. Then treat your pets for ringworm, your dogs, your cats, whatever pets you choose to have. Please always treat them for ringworms. Take them to their vet, let them get their vaccine doses, let them be treated for whatever infection so that it won't transfer to you. Disinfect surfaces regularly, okay, with antiseptics, because you could also get these things from surfaces, right? Then wash your hand thoroughly after contact with animals. Also, ask your healthcare provider about means to improve your immune system. I need not tell you that a balanced diet and good exercise are one of the major ways to improve your immune system, so that no infection can stay on your body. Okay, if you treat ringworms appropriately, they should not come back. But if you do not complete your doses, Don't be surprised that you just see it as a regular visitor on your body. Okay, so that is it about ringworms today. That is what I want to tell you. Please take care of your health, take care of your skin, okay? But peradventure, you have tried everything to prevent, you have been to your doctor, to a pharmacy to try and treat ringworms, okay? But they keep coming back. Please see your dermatologist. They are the specialist skin doctors. Please see them. It could be because of something else, an underlying cause, and it could just be a symptom of that. All right. And that is what I have for you on today's episode of the Anti-Pharmacist podcast. I hope that you've gained something. Like I always advocate, please continue to like, to follow, to subscribe to this podcast, and to share with as many people as you can. You will agree with me that this information that I'm sharing with you, they are very important for your health. As always, prevention is better than cure. So it's better to know what these diseases are or whatever I'm talking about so that you can follow appropriately and safeguard your health. All right. Once again, please continue to support me on my social media platforms. If you have questions, send to my mail, anti-pharmacistpodcast@gmail.com. And you can send via DMs too on Facebook. I'm there as Anti-Pharmacist Podcast. Same as Instagram. On TikTok as well, Anti-Pharmacist Podcast. On X, Fan Podcaster. I'm on LinkedIn. My personal LinkedIn page is where I share my content from my podcast on. That is Bemisola Debisi Jose. Continue to support me, guys. I need it to keep growing this podcast. And on YouTube, guys, I don't want to promise a date for my video, but I'll just surprise you with it. Maybe that will encourage you to subscribe. Okay, but please let that not be a discouragement for now. Please subscribe to my YouTube channel, like the content, leave your comments. It helps increase the visibility. And that is all on today's episode. Take care of yourself. I'll see you next time. Till then, stay healthy and God bless you.